I was in Wyoming, in Jackson Hole, not Jackson Hole, Wyoming, in Yellowstone National Park. And I camped out there, and I received a tick bite. At that time, I was living in Eastern Washington, a small town, Newport, Washington. They had a hospital. I explained to them I had been bit by a tick and I needed some care. I told them that I needed antibiotics, and they gave me a test for Lyme disease. Now, this is about 4 days after I had been bitten, because I had driven back. The test came back negative. 3 weeks into it, or 2.5 weeks into it, I got sick again. I went back to the hospital and I said, there's something really wrong with me. I had lots of pain, I couldn't use my arms. I had lots of congestion. Interesting enough, I had to stop almost combing my hair. My scalp hurt. I had trouble with my eyes. I wasn't focusing well. So I went to see an eye surgeon. The surgeon looked at me and said, there's nothing wrong with your eyes. And then I had the headaches. So I went to a brain surgeon. I had the MRIs and the scans. I said, you're a 70-year-old man, 65 at that time actually. And you're not in too bad a shape, but you've had some brain injuries over the years and whatever else, obviously a police officer and things. But you don't have any real brain damage. Then I'd say the rheumatologist, because of pain in my joints and whatever. So I went and saw the rheumatologist. Same thing. You have pain, but we don't know what's causing it. They give you the tests. We pretty much decided at this point in time, there's got to be something here. We decided to come down and went to Envita. It was found on the internet, and they ran a test. I stayed for a couple days, and the test came back and said possibly I was a candidate, and I actually possibly have Rocky Mountain fever and Lyme disease. Oh boy! I think that the amazing thing is when I showed up here, I had actually had I call it an episode. So I was still sweaty, shaky, and red when I walked in the front door, and very confused. My daughter flew down, so I wouldn't make a mistake while I was here. The front staff, never seen such a professional staff, and everybody knows everybody's name. I walk in the front door again with the mask on, with 10 or 15 other patients at different times throughout the day. The next day came back in the front desk, everybody remembered my name. I went, that's amazing. And we're sent off to our different rooms because we all have different procedures every day, which is nice because I meet all these different people. Lyme patients that are brand new, Lyme patients that have been here a long time, cancer patients that have been here for a while or brand new. We all help each other. The patients talk to each other. I meet with my physicians. When I say physicians, I have several. On a weekly basis, especially if I've had tests. They answer my questions. They change my protocol. Very professional. Every one of them here is here because they want to be. And I don't think this is a job for them. I think they want to be here. The nurses, unbelievable staff. The care is amazing. Every patient here has a different stage of cancer or Lyme disease, and we don't all receive the same exact protocol or the same exact treatments, and it changes daily. And they take blood tests and another test, and the doctors change what we take. To anybody out there that has hit the wall, you've got Lyme disease, and you need to come here. The big thing is you have to not give up. You have to get here, and then they'll help you.